Hi, I'm Lance DeLange with Yada Yada. This video will talk about Dupuytren's contractures. A Dupuytren contracture is a scar tissue type formation of the fascia that occurs inside of the hand. It's not scar tissue from trauma or injury, but it's a contraction of the tissue that can occur in the palm of the hand. It can occur in other places of the body, but we'll talk specifically about here. It's most common with people with ancestral descent from Scandinavia, but anyone could suffer from this condition. It's a slow-growing condition where there is a contracture chronically over time where the tissue tightens up, leaving you a linear type scar-like appearance to the hand. It can occur in any of the fingers, in any location. It can extend up into the fingers. It's usually a very slow, gradual growing problem. And over time, if it extends up into the fingers, you can end up with a contracture where the finger can contract down and get stuck. If you're developing this, if it's in the early stages, there's a few stretches and exercises you can do to be sure that your finger or the hand can fully extend. But if it's developing, it may continue to do so regardless of your treatment of it. If it becomes problematic, you could seek professional help. Depending on the scenario and your provider, there are a few options that can be done to treat it. Of course, if it's giving you discomfort, soreness because it's rubbing on something, a tool that you're working with, etc., of course you could wear gloves or something to pat or protect it. If it gets beyond this, where it's contracted down and it's really problematic, some properly trained professionals could give you an injection of an enzyme that can facilitate breaking down of this tissue. Another potential way to get rid of it could be a surgical excision of it. Be sure that if you're going to proceed with the injection, that this is done only by a qualified individual who's had proper training, as doing so incorrectly could cause other problems with tendons or other structures in your hand. But if the injection is performed, this may then be extended and released, causing this to open and break apart the ligation, the tightening of that tissue. Or if it's surgically excised, the incision may go up and carefully dissect out this contracted tissue. Doing so then could restore motion and function to your hand and fingers. So it's not an emergency if you find that you've got this Dupuytren's contraction, but do understand that it can get worse with time, can become more debilitating, and end up losing motion. It could still be performed later on once it's much tighter, but you may have other difficulties developing with your hand, finger, or joints because of the finger being unusable or not properly being used over time. So if you find that you have this, please seek out medical attention by a qualified professional to seek out what option may be best for you. As always, stay safe out there and thank you for joining us. Have a great day.